Bismillahirrahmanirrahim. Right, gentlemen, today we are going to talk about renal cell carcinoma. Now, there are different varieties of renal cell carcinoma, um, like clear cell renal cell carcinoma, papillary renal cell carcinoma, medullary carcinoma. But today we are going to discuss only clear cell cell carcinoma, which is the most common variant and the most important one with respect to your examination. Now, the clear cell renal cell carcinoma, it comprises around 70% of all the renal cancers. So from here um, uh, you can easily understand what is the importance of discussing this particular tumor. Now these tumors are typically um, single or solitary and located in the cortical region of the kidney. We'll see the gross and H&E photomicrographs, the gross pictures and H&E photomicrographs shortly. But remember that these are generally cortical tumors. They reside in the outer area of the kidney and they protrude from the surface. Upon microscopy, um, they show three major patterns. One is the solid pattern, the second one is alveolar pattern, and the third one is the acinar pattern. Another thing to remember is that there is a network of small thin-walled vessels surrounding the cells in some of the tumors, rather many of the tumors. Okay. Now here is the gross morphology and microscopic picture of clear cell renal cell carcinoma. You can see here this is specimen of kidney cut section. This is the normal part of the kidney. This is the normal part. This is the normal part. Now, if I ask you to describe the specimen, you say that these are the normal areas, and here we see an abnormality. Now, this is a tumor that, like the classical description, is protruding above the surface of the kidney. You can see the normal surface of the kidney ends here, and this is the tumor that is protruding above the normal surface of the kidney. It is yellow or yellowish brown in color. Actually, it looks more of yellowish when we see such a tumor in practical life. So this is more of a yellowish tumor protruding above the surface of the kidney, and it is sharply demarcated from the surrounding normal kidney. You can see here, this is the interface. This here is the tumor, this is the normal kidney, and there's a sharp demarcation, and this is a circumscribed tumor. It is not, at least on gross inspection, it is not invading into the surrounding normal kidney in this region or in this region or in this region. So it is a round circumscribed thing you see here in the cortical and the predominantly in the cortical region and extending into the medullary region of the kidney. Now, a few words about the microscopy. We just read that there are three patterns: solid, alveolar, and acinar. If I try to describe it more simply, what you see here is these are nests of cells, different nests of cells or different groups of cells, uh, which have a clear cytoplasm. The name of the tumor indicates that the cytoplasm is clear cell renal cell carcinoma. Now, the cytoplasm is in many cases clear, although it can be a bit eosinophilic in some of the cases. And then the nuclei, which show prominent nuclei, are also seen in some of the cells. It depends upon tumor grade, how many prominent nuclei are present. Um, but you can see if you focus on this cell and its nucleus, there's a central prominent nucleus that is visible. Okay, and then another thing we talked about is the fine capillary network. This is a very fine vessel. This is a very fine vessel. This is a very fine vessel. So this is the capillary network we're talking about that can be seen in clear cell renal cell carcinoma. So, and the cells, the cytoplasm, clear, eosinophilic, nuclei may be prominent. Okay, the nuclei may be round, and they may have prominent nuclei. Generally round in shape, and nuclei are prominent depending upon the grade of the tumor. So this is it for now. If you have any questions, please let me know.